Hi, my name's Aaron Thomas and I'm a senior physiotherapist at Kensington Physio and Sports Medicine, and I work out of the Chelsea and Notting Hill clinics. Today my review is on acetabular labrum tears or hip joint tears, and whether physiotherapy techniques such as soft tissue massage, stretching and strengthening can improve the pain and hip function of the person with the labral tear and hopefully avoid any surgical intervention. So the acetabular labrum is a rim of cartilage surrounding the hip joint. Its function is to deepen the socket and increase the stability of the hip joint. Unfortunately, due to repetitive loading or acute injury, you can develop a tear of the acetabular labrum. It's generally from twisting and repetitive impact type sports such as running, squash, tennis, football. And once this tear develops, a patient may develop pain, catching type pain, a feeling of giving way, instability, and the pain usually goes into the groin or the outside aspect of the hip joint. Not all patients have pain with an acetabular labrum tear, but unfortunately a lot do. The first form of treatment for these patients is physiotherapy techniques such as manual therapy and strengthening exercises, and unfortunately sometimes if we're not getting it where we want to get to with those type of techniques, surgical intervention may be the last resort. The study that I'm looking at today involves assessing 4 patients that have a diagnosed acetabular labrum tear. They were assessed before treatment and then underwent 8 weeks of physiotherapy and then were reassessed after that 8 weeks. They were looking at the amount of pain and the amount of hip function for those 4 patients. The 8-week program involved soft tissue release to the gluteal muscles and the hip flexors, as well as stretching and strengthening exercises of those muscles as well, to basically stabilise the front of the hip and stabilise the back of the hip. And the hope was obviously to decrease the pain and increase the hip function. After the 8-week period, all 4 patients has a significant increase in hip function and a decrease in pain, which was really good from a physiotherapy aspect. The key point from this study is that patients with an acetabular labrum tear don't necessarily need to go for hip surgery straight away. A form of physiotherapy, a 6 to 8 week program consisting of soft tissue release, stretching and strengthening exercises can play a big role in decreasing pain and increasing hip function, and therefore hopefully avoid any surgical intervention. Thanks very much for listening to my review today, and I look forward to the next review in the near future. Thank you.